Another day, another cost of living challenge. This time, it's private health, with insurance premiums skyrocketing, forcing Australians to wonder if they can afford to put a price on good health. For many Aussies, the literal cost of living is becoming too high a price to pay.
Private health is a good thing, but it's starting to get sort of to a level where most people can't afford it.
I hope someday the premium can come down, but right now it's quite expensive.
I'm older, I mean, you have to have it.
New data from Choice revealing private health insurers have hiked premiums by up to 5 times the government's approved increase of 3%.
Health insurers will justify it in terms of cost inflation, but the problem is that these policies are often for the most vulnerable Australians, and it's just not fair that they have to pay so much for that health insurance.
NIB's gold policy increasing more than 9%, HBF's by 15%, while in WA, Australian Unity customers could cop an increase of more than 17%. Choice's survey of more than 24,000 policies finding just 29 had increased in line with the government's recommendation.
The government subsidises the private health insurance industry to the tune of a few $1 billion a year, but if we're seeing these top-level cover policies go up by almost 5 times more than the industry average, then that really raises the question, is the private health insurance industry still serving its purpose of receiving that money from Australian taxpayers?
As single Aussies are slugged almost $2,000 a year for insurance, more than 350,000 of us have been forced to cancel our cover.
When you're the person that's actually, on the other end of it and trying to just get by high rent, that's when you're really starting to question, is that really fair?
For their part, insurers argue patients aren't the only ones suffering from the symptoms of inflation.
Hospitals have had to factor in greatly increased costs. To be able to offer value for money, we have to be able to cover those costs.
But as 1 in 7 of us struggles with the price of private health, the price we put on our health has never been higher.
Have a good think about what type of health insurance you actually need. Top-level health cover covers things like childbirth, hip and knee replacements. So have a think about whether you need those things or whether you can buy a lower level of insurance.
Coming to you live from the lands of the Kulin Nation, with us is Finder.com's insurance expert, Tim Bennett. Tim, what's behind these massive increases?
Well, the price of health insurance goes up every year, and it's because it gets more and more expensive to provide health insurance. Unfortunately, that means some policies cost more to insure individual people than others. So, for example, a gold policy has more complex treatments, which means the price is going to go up faster.
But Tim, I don't understand, if the government approves an increase of 3.03%.
Yeah.
How do private insurers get away with increasing premiums by up to 17%?
Yeah, it's all about averages. So that 3% number, and if you break it down by insurer, those are all averages. And unfortunately, that means that your specific policy is almost certainly not going to rise by 3.03%. It'll rise by 5 or 2 or 7 or sometimes 17. It's maybe not the best system in terms of transparency of information.
Tim, do you think that these rises are fair?
I think they're in line with what I would have expected the private health insurers to have pushed their premiums up by. The cost of living is affecting everyone, and inflation affects me, it affects you, it also affects the cost of medical care that the insurers have to pay at the end of the day. There is definitely an argument as to whether or not they're giving back enough in benefits that they get back in premiums. There are some, ideas that maybe there should be at least a 90% bar of the amount that they return back to members. But yeah, I think it's probably a reasonable amount in the current system at least.
So what advice would you give to people who are worried about their health insurance premiums?
The advice is always the same, which is to compare and make sure you're on the best option for you. If we can't change the policy that we live in, at least we can do our best with the situation. And there are deals out there, and you may very well be paying for a private health insurance policy that you don't need. Maybe you don't even need it at all. That's definitely something you have to decide for yourself. But, if you had all your kids, you probably don't need childbirth, for example.
I'm very happy to hear that.
So, Tim, premiums, I feel like this is a bit of a naive question, actually, and I know what the answer's going to be, but I'm hopeful. Are premiums ever going to go down?
Probably not, no. Unfortunately, look, inflation is everywhere. Even in a normal year, inflation's supposed to be around 2%, which means that typically prices should go up slowly. if the government did want to put some downward pressure on prices, they'd have to actually change the policy situation. And at the moment, that doesn't look like it's a particularly high priority for either party.
Tim, we were getting on so well. Such sad ending.
Sorry for the bad news.
Tim, thanks for your time.
Cheers.